Hello, my name is Elijah Jones, and I'm a consultant with the Ohio Association of County Behavioral Health Authorities. Welcome to today's recording on OhioRISE with our presenters, Kelly Smith with the Ohio Department of Medicaid, Leanne Margree with Aetna, and Jessica Horowitz-Moore with the Ohio Department of Education and Workforce. We thank you for taking the time to attend this recording, and we hope you find the information useful. This webinar is co-sponsored by the Great Lakes MHTTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTTC are funded by SAMHSA under the following cooperative agreements. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services and SAMHSA. The MHTTC network believes that words matter and uses affirming, respectful, and recovery-oriented language in all activities. Again, we thank you for viewing this recording. If you have questions, please feel free to reach out to the presenters. Their contact information is at the end of this presentation.
Hi, I'm Kelly Smith with the Ohio Department of Medicaid. I'm the External Affairs Administrator for the OhioRISE team. Thanks so much for joining to learn more about the OhioRISE program and how OhioRISE can support educators and schools and the youth and families they serve. Today, I'm joined by two of my colleagues who I will let introduce themselves.
Hi, everyone. My name is Leanne Margree. I am the Executive Director for Children's System of Care for Aetna OhioRISE, and I'm very excited to be with you today to share with you about the OhioRISE program.
And hello, everyone. I'm Jessica Horowitz-Moore, and I'm the Chief of Student and Academic Supports at the Ohio Department of Education and Workforce. I'm also thrilled to be here today, and as a former elementary school principal, I am just so excited to share the information about OhioRISE with all of you.
Thanks. All right, so let's dig into the OhioRISE program. OhioRISE is a specialized managed care program that focuses on children and youth who have significant and complex behavioral health needs. These are substance use needs or mental health needs, and they're also involved in multiple systems. OhioRISE launched July 1st of 2022, and it's really about a long-term commitment to building out services and supports across the state that's community-based and keeps families close to their homes and with their families. OhioRISE is built on a system of care and wraparound philosophies. The system of care means how communities and child-serving partners come together and develop coordinated and comprehensive responses that better serve children who would otherwise be bounced around from system to system. Wraparound philosophy is where a family-based team comes together of caring adults, and they develop creative solutions that are tailored to each young person's circumstances and helps to refer them to different services and supports in their local community. OhioRISE has about 40,000 members already enrolled into the program. If you look at the pie chart, we have a breakdown of our age demographics, and you can see that the majority of our youth are adolescents. So just about 52% are 14 to 18 years of age, followed by 6 through 13, and then 19 through 20 at 11%, and 3% of our members are 0 through 5, and just about 1% are 21 years of age. Since launching the program in July of 2022, we've served approximately 3,800 kids in foster care. We continue to add new providers of services across the state. We are also working really hard to make sure that we have care coordinators across the state, establishing 800 care coordinators who work at care management entities that we'll talk about in just a moment. Some of the creative ways that we are able to provide that wraparound facilitated care is by the menu of services and supports that OhioRISE offers, such as flexible dollars and respite. And so we've been able to deploy those services. And those are the ways that we help tailor creative solutions to what families and youth need. To ensure that the OhioRISE program is successful, we have different measurements for success. Is our program helping to reduce custody relinquishment for children, youth, and families? Are we able to keep families together and supported in their community? We also want to make sure that we're reducing unnecessary hospitalizations, decreasing involvement with the juvenile justice and correction system, and reducing out-of-home and out-of-state placements. And for this audience, we look at increasing school attendance and performance as a measurement for success. So let's talk about who is eligible for the OhioRISE program so they can access these important services and supports. They have to be 0 through 20 at the time of enrollment into the program. They have to be determined Medicaid eligible. And one of the most important requirements is that they have to, again, have those intensive and significant behavioral health treatment needs, which is determined by an assessment called the Child and Adolescent Needs and Strengths, or the CANS assessment. They may also become OhioRISE enrolled if they have an inpatient stay in a hospital for a mental illness or substance use disorder. As I mentioned, when a youth is determined eligible for the program, it's determined by an assessment called the CANS. The CANS is the Child and Adolescent Needs and Strengths Functional Assessment Tool. This tool really looks at the whole picture of what's going on with the family and the youth. So it looks at just not only the child, but also the parents and the caregivers. And it doesn't just look at their needs, but it also looks at their strengths to build upon those. It provides decisions and support models to identify appropriate care. It's also used to assist with OhioRISE program eligibility determinations, as well as determinations for eligibility across our state partner agencies and their programs. And it's used to support OhioRISE care planning. We did include on the right-hand side what the CANS purposes are for as well. So there's a list of them for you. One section of the CANS assessment rating that I wanted to pull out for you is around school behavior. Some of the questions that we ask students and youth are, how is the child or the youth behaving in school? How has the child or youth had any detentions or suspensions? Has the child or youth needed to go to an alternative placement? Based on these questions, there's descriptions for different ratings 0 through 3. If the child receives a 0, then there's no evidence of any need and no action needs to be taken. If they answer to any of those questions a 1, then there is an identified need that requires some monitoring or some watchful waiting. If the child scores a 2, there is an action that's required to ensure that the identified need is addressed. If there's a 3 that is rated for any of these questions, that need is considered to be dangerous or disabling and requires immediate or an intensive action. There are several other questions around school attendance and school achievement that are asked about during the CANS assessment. I gave that example so that you could see that when children are a part of OhioRISE, we know that they're also involved with other systems, including the justice system, the developmental disability system, and of course, they have behavioral health needs that happen at school. And so that last slide with the different questions around school behavior pulls together this data where we can see that 23% of our OhioRISE enrollees have shown to have an actionable need, so a 2 or a 3 rating, as a behavioral health need at school that requires some action to be taken. And this could mean that the OhioRISE wraparound facilitated care would involve a school system partner. I'm now going to turn it over to my colleague, Leanne Magre, to talk about the OhioRISE services and care coordination.
Thank you, Kelly. OhioRISE brought to Ohio new services as well as an expansion of current services that are available through mental health and substance use disorder. We put together a long-term commitment to build capacity in communities for these services to continue supporting youth and children and families within their homes. Some of the services are continuing. These are services that youth and families have already been receiving, but we have expanded some of them and we have created some of them in order to help support our youth and our families more across a continuum of care. We have care coordination, and we're going to dive into care coordination a little more specifically in just a minute. But it's based on the tier level. The CANS assessment that Kelly just talked about will identify the level of need that the youth and the family may have. And that puts them in a tier level that identifies the amount of support that they might need. And then within that support, there's a care plan that's created. We work with the family to access services and resources to help address the needs that are identified. And we also look for providers to help support that care. We have intensive home-based treatment, or IHBT. We are in the process of making significant improvements to this service. It has just expanded significantly across the state to where more services are available to youth and families within their community. This is a very unique service that provides a short-term intensive home-based service so that a youth can continue to live at home and yet receive those significant services that are necessary to help support the family and the youth. Behavioral health respite is a new service that was brought forward and expanded upon as well as part of OhioRISE. This is a short-term temporary service that is in place to help give a break, to provide some separation, some buffer for the youth and for the family so that they can maybe rest a little bit, maybe be able to focus on something a little different for a short period of time so that they can then stay in the community and continue to receive the services that they are receiving. Mobile Response and Stabilization Services, or MRSS, is in the process of expanding right now. This is an immediate behavioral health service for youth and children in crisis. And it can be used in any behavioral health situation where the caregiver may be thinking that they need to go to the hospital or I need to call the police. Instead, calling MRSS would be the option to support and ensure that the youth is getting the support, the family is getting the support necessary. We are expanding this service right now to where it will be available in just about every community in Ohio. Primary flex funds, Kelly mentioned earlier, these are unique funds, about $1,500 in a year period to purchase specific resources that may address a specific need that might not otherwise be covered by Medicaid. These are Medicaid funds that are required to reduce the need for Medicaid services, to keep a youth in their home and safe in their with their families, and to keep them integrated into the community. These are not funds you can just go buy anything with, but they are very special funds that do provide some unique opportunities for families and youth within this program. And Psychiatric Residential Treatment Facilities, or PRTF, is a brand new service that's been brought to Ohio. We're not quite a year into it. We started in November of last year. We have 2 facilities that are open in Ohio and one that is getting ready to open in the month of September, and more that are opening in the future. And these are facilities other than hospitals that provide that intensive psychiatric residential service for individuals age 20 or under that can support them, get them some intensive treatment, and work toward integrating them back into their community. All of these services are available in addition to the Medicaid services that were already available to anybody else that's on Medicaid. Not every youth in OhioRISE will receive these services or even qualify for these services, but this continuum of care gives them opportunity and access to meet any unique need that they may have. What is a care management entity? One of the unique pieces of OhioRISE is we have employed care management entities across all of Ohio. There are 18 of them that serve the communities across Ohio as the locus of accountability for delivering the wraparound model that Kelly mentioned within a specific geographic area of Ohio. They are the go-to place to help families, providers, and the school system to be able to help support the youth and families within the community that they are operating within. Their primary responsibility is to provide care coordination, and we'll talk about that in just a minute. This is wraparound driven, and every youth enrolled in OhioRISE is assigned a care coordinator that will work with them and their family to coordinate this care. And the CME is also responsible for community resource development. They are responsible to work with the community stakeholders within their geographic catchment area to figure out what the needs are, grow services that need to grow, develop services that need to be developed. And Aetna comes in to support the CMEs around that work. It is our responsibility to help give them the tools they need, help find the providers that need to be engaged in the treatment and service process, and support the growth within the community in order to provide what the youth and families have said that they needed in order to stay in their community and thrive in their community. So let's talk about care coordination. OhioRISE care coordination is based on a high fidelity wraparound model where a dedicated care coordinator is responsible for pulling together the team of people that are already working today to serve that youth and that family. As the school system, you are already serving this youth and this family that's been referred to OhioRISE, and you are doing some phenomenal work trying to keep it together, trying to meet some needs, helping to support the youth and the family in the way that you can. And a care coordinator will come to you and to the other individuals that are providing that care, the therapist that's already working with the youth and the family, the psychiatrist that's already working with the youth and the family, the church that's already working with the youth and family, and pull them together into one coordinated group of entities to work as one voice to serve and support the youth and the family. So you've got natural supports, which are extended family, neighbors and friends. You have community supports, such as the school, the neighborhood, faith-based, and all of them are brought together in a team. They're already a team to begin with. They're already serving to begin with, but now they're all at the same table in order to best meet the needs and the care for the youth and the family. The child and family team, that's what becomes, is the child and family team is pulled together to coordinate this plan and run this plan. The care coordinator just facilitates, but the team is who is driving and ensuring that the family is heard, that the family and the youth are receiving the services that they need. It dives into what the CANS has identified, and it ensures that the current partners that are working together are there, as well as who's missing from this team. Who do we need to bring on board? What service in that array that we just talked about might be necessary? So this team comes together through this care coordination process. And now let's talk about a success story that we have regarding a youth that was served through a CME within care coordination. This particular young person was enrolled in online school and was really having some complex behavioral health needs. At first, the youth was not doing well, was struggling a lot to manage their frustrations. They were having angry outbursts that involved screaming and hitting and stomping their feet. So, of course, they were not able to really meet their educational needs in the school setting. And so they were online. But that also separated them from their community, from their friends, from normality of life. And that led them to rarely leave their home and not have a lot of friends. The care coordinator through the CME pulled together a group of people to work with this youth and this family. And that included the therapist, the developmental disability worker, the local school system, as well as the family. The family started working with the therapist on the treatment needs that they had. How can we support our child through this process? There was homework that they had to work on. So it's not just the youth that has to work on stuff. The family also has to do some work in order to best meet their youth's needs. And through this, the additional services were put in place as well. A psychological evaluation was done to ensure that we understood what resources were necessary to support the education and the development of this youth. And as a result of all of these groups working together, the youth was able to go back to attend school in person. And the school staff were so excited to report that the youth was making progress, was doing well in class, and making friends. And then the family received flex funds to support the youth to go to the YMCA, which extended that youth's friend group and activity opportunities so that they would be able to get out of the house more and really begin to enjoy life a little bit more. So now I'm going to turn it over to Jessica to talk a little bit more about how schools can refer.
Thank you so much, Leanne and Kelly. And yes, I am very excited to talk a little bit more about, so now that you know a little bit more about OhioRISE, what students can be referred and what should schools be doing to implement this program? So when we think about what youth may benefit from OhioRISE, we're obviously going to look at the factors that Kelly talked about earlier, but also think about the kids that we have in front of us. OhioRISE supports youth and their families who have complex behavioral health needs, and they may be involved in multiple systems. This includes youth that might be involved in child protection services, court, or development disability system. OhioRISE students and children also may have complex behavioral needs that arise during or after school. Those would be some of those behaviors that you may witness in your classroom. And these students can be referred to OhioRISE in order to provide them with the supports and services that are offered through this program. Now, when implementing OhioRISE at a school or a district, it's really important to think about how is your individual school or district going to put this in place. We know that throughout our state, we have very different communities and things could look different at each school. So what you'd want to do is work with your in-school team and determine a plan for your school of how you will refer students to OhioRISE. Make that determination, who is the referrer. So this could be an individual teacher, but it may be the principal, a guidance counselor, a social worker, whatever the team decides would be best for that student and for your school. Also, what's really important as you're looking and thinking about making an OhioRISE referral is speaking to the family. We know how important it is that parents and families are our partners in school. So we want to make sure that families understand what it is that we're referring the child to. Now, as the school, you may not know all the ins and outs, and I know Kelly and Leanne did such an amazing job teaching you a little bit more about OhioRISE, But you could give families the overall view of what the services may look like, but then making that referral and letting the experts really talk to the family about what services that their child may be eligible for once they take part in that CANS assessment. It's also a really great tool to build that relationship with your with the care management entity in your area and the Aetna support staff, because these are individuals that could help out on a plethora of matters. They could be somebody that when you're having a back to school night or a curriculum night, they could host a table and teach your community about what services they may have to offer. So that's all part of the referral system. And then there's also, as Leanne mentioned, and I'll talk a little bit about later, is the MRSS or Mobile Response Stabilization Services that are available during a crisis at school. So now that you may have a child identified, someone that you think could benefit from OhioRISE, how do you know how to refer them? Who do you call? So OhioRISE, as shared before, is throughout our entire state, which is so exciting. But the state is broken up by counties to determine who is going to be the care management entity in your area, or CME. So, for example, if you're in Knox County, in the bright green, you would see, look to the right and see Knox County. In the bright green is served by I Am Boundless. So that would be the CME for that location. So now, and you could see there are some multiple counties that are may have one CME. And then we also, as we well know, there are some larger populations in our state. So if you look at Cuyahoga, Franklin, and Hamilton counties, those counties are divided in two as to who their CME may be, just because the amount of students. So for example, I was a principal in Franklin County. I was on the east side of Franklin County. So for my students, I would have referred to the Buckeye Ranch as the CME. But you could, there's a link embedded in this slide that you could look at that gives you a little bit more information. So, let's say Knox County, and I've just decided this next slide will talk to us about how we can make that referral. So looking at Knox County and I Am Boundless, we could see if you scroll down to area M, I Am Boundless has an online referral portal link, so you are able to click that link right there to make the referral. There's also direct email information for staff members that you could directly contact. And then, of course, you know, when you are in a crisis, sometimes you don't want to just rely on and wait for an email, but you want to call someone, you want to get someone on the phone that day. There are also phone numbers that you are able to call right away to make that referral for a student. So this chart really just identifies, again, our CMEs throughout the state and who to call, how to make those contacts. Now, as I said before, in Cuyahoga, Hamilton, and Franklin counties, CMEs split those counties in half. So the next couple slides really just dive into the zip code, determining who exactly would be the care management entity for those individual counties. Now, contacting the care management entity is one way that you can make the referral for OhioRISE. Now, you may be unsure of who that is, or if you're unable to get someone right away, there are other options for making the referral. So one option is you could contact the Youth Managed Care Organization, or MCO. Again, as a principal, I know sometimes if we had a student we were trying to make a referral, we'd have their insurance card. So if you have your student's insurance card, if they're a student who's enrolled in the Medicaid program, you could easily see on this slide where it goes through who you would call to make the referral. Also has email information. So if you have a student who has CareSource, there's a phone number available and email where you can make that referral for OhioRISE. And those referrals are scheduled within 72 hours of that referral. So again, and the CAN's completed within 10 days. So really, when we're making referrals to the OhioRISE program, the team is amazing and just really trying to get our students assessed and determine if they are an eligible candidate for the program as soon as they're able to. But there are still more ways that you can make the referral. Again, it's always important that we could access systems in multiple different ways. Could always contact the Ohio Department of Medicaid. They have a whole consumer hotline dedicated to helping families, and they could identify who the CANS assessors are in that community and get a CANS scheduled. Also, you could always contact Aetna and the OhioRISE plan. where they're available from 7 a.m. to 8 p.m. at night, Monday through Friday. And again, they are happy to help take a call, help coordinate, and get a child set up for a CANS assessment and determine that eligibility for OhioRISE. And then even more so, again, our team that has created this service has just been amazing. And we know that, depending on the time of day, depending on needs, sometimes you just really need to talk to someone. So we also have regional OhioRISE coordinators. We have the state split for Central and Southwest with Frank, and in the West with Nick. These two individuals are also experts at everything OhioRISE, and they are available to families, schools and districts, community organizations, anybody who needs more information, they are available. So they are also a tremendous resource when it comes to what OhioRISE has to offer. Just a little bit ago, we also had Leanne talk about MRSS, and this is a service that I absolutely wish that I knew about and existed when I was in the building. So MRSS, or Mobile Response Stabilization Service, is a hotline that is available to families, and certainly in your positions to schools, to help with a behavioral health crisis. So, you may have a situation where a child is having a major behavioral health crisis during the school day, and sometimes you don't know what to do. Your options in the past may have been you call your school resource officer, you call 911, you take a child to the emergency room, and those are all still options. But MRSS currently is operating in 47 counties. Like Leanne shared, we're trying to have this program go statewide, but this is a number that you could call to have behavioral health emergency services come to the school to help a child in need. And again, this is really could have huge benefits for our students, for the school. When a child's having a behavioral health crisis, we know that we need to intervene right away. We don't want to make that situation worse, or we want to have the best results possible. And MRSS is a service that can provide that. So again, as the slide says, there's a growing body of evidence that shows that, having MRSS could lead to better outcomes than having another emergency room visit or calling the police. This is really a service to help stabilize a family and a student. And then MRSS could also help make that determination about getting a CANS assessment done, OhioRISE eligibility. So lots of positives with the MRSS program. And now to think about another success story. I know Leanne shared one of these earlier, but another success story for the OhioRISE program. This is a success story for a teenager who had a history of depression, who was living with their grandmother, really became very withdrawn, wouldn't come out of their bedroom except to eat or use the restroom. Any of the interactions between this youth and their grandmother was conflict, emotional detachment, just really a struggling relationship. So this youth was enrolled with OhioRISE and assigned a care coordinator who began to come to the home and to build rapport with the teen. And the student also was refusing. I mean, obviously, if they're in their room refusing to go to school, that was a big part of their challenge. So the care coordinator would come to the house and would sit outside this youth's room to try to build that rapport. Once they began to talk, they were eventually able to engage, which was really exciting. The teen opened the door, and as part of this connection and this relationship that was built, we're finally able to get this teen to return back to school. And with the rapport that was built between the teen, the grandmother, the child was then worked on and working to set up counseling and psychiatric services, being able to really provide the family the support they needed. And from the educational perspective, this was, getting the child back in school was so important. And all these services and this connection needed to be made before this child was able to do that. We think a lot about in education, chronic absenteeism, and what do you do when you don't know what to do for a child like this who's just refusing. But again, just really exciting that this care coordinator was able to use their skills, build that rapport, and get this child back to school and take those slow steps. It didn't happen overnight, but was able to make that relationship, get the service they need, and return the child to school. So a very exciting success story for an individual student. And now the next slide, we're going to talk about just really exciting, a success story for a school district. So like I shared earlier with OhioRISE, each school, each district needs to make the determination what works best for their community in terms of how your plan is to utilize the OhioRISE program. in this school district, Bridgeport Local Schools, they were going through some facility changes and a big changes to their community and school district. And as part of this, they built such a great relationship with OhioRISE. They actually provided office space for OhioRISE in their school district, which has been really great as part of a broader expansion network, but really working to integrate OhioRISE into their community. Because they were seeing the benefit, because it just worked out. This is in Belmont County. It was a perfect fit for them. Now, would this be the perfect fit for every county in Ohio? Not necessarily, but for them it was. They were able to build this relationship where OhioRISE really, they were trying to integrate not only to the school, but to the community, and they are seeing the benefits. So this strengthened partnership was just really, as Superintendent Brent Ripley said, just it's been OhioRISE a boon to the community, and they're doing good for a lot of people. A lot of good was happening. So it's great to see that this is, what's working in their community, and just shows an opportunity that schools and districts could look at as to what makes sense for them in terms of their interactions with OhioRISE. There are just so many benefits, so many different ways schools and districts could look at those partnerships, but OhioRISE is, again, it is statewide, and our care management entities, our care coordinators, they are so excited to build those relationships with schools and districts because they want to help students and families. And working together, I do believe that so much good can be done from that connection. And now I'm going to turn things back over to Kelly to share a little bit more, but thank you for your time today.
Thanks, Jessica and Leanne. And to wrap things up, we wanted to provide resources for schools and for families. So we have an OhioRISE brochure and flyer that the schools can have at their fingertips. You could have these printed out, or you can send them electronically to families. It provides different topics that are covering things like eligibility for the program, what the covered services are that Leanne went over, what's the difference between these services that are provided here versus Medicaid, what's a CANS assessment, how to schedule a CANS assessment on your own, how to get more information on the OhioRISE program. And this brochure is also available in additional languages that are listed here. And these are all available on our website as well. And we wanted to provide our contact information for you. So we have a general OhioRISE inbox, ohiorise@medicaid.ohio.gov. And then the presenters that joined me today are Leanne Magri again, and her email is listed here, as well as Jessica Moore Horowitz, as well as myself. Thank you so much for attending this presentation to learn more about OhioRISE and how it can help benefit the families and youth that you serve.